members of parliament, members of the diplomatic and consular corps, our development partners, the civil society, distinguished ladies and gentlemen, good afternoon. On behalf of the leadership of this country, His Excellency President Julius Maada Bio, the Honorable Vice President, and the entire government, I want to wish you World Mental Health Day. I want to also recognize that it's World Sight Day. So today is just a day of health. And I know that there are many activities happening across the country, and many more will happen today. But I'm really delighted to see that the room is full and you've stayed throughout the entirety of the day. And it underlines and it reverberates the comments and commitments from the ministers that you just heard and from our development partners. So today I probably will speak a little bit about some examples and to tell you about why it is so important that we have a revised governance manual and how it's linked to the vision of His Excellency and the priorities of this government. We all have heard the link between health, human health, animal health, plant health, the environment, and how it has direct impact on the entire country and on the entire governance. Sierra Leone is no stranger to this, and in fact, one will say will become an even more resilient country because of our experiences. From Ebola to the mudslide, which led us to setting up the One Health platform anyway in 2017, and consequently seeing how that was tested during COVID and throughout our response and our National Development Plan engagement. That led us to think about revising this document. That has led us to work together. We've been forced to work together. But that naturally came from who we are as a people. As a people, we work in communities. As a people, we are in sync with our agriculture, with our plants. We're in sync with our animals, and certainly with our environment. And it is important then that we as a government went ahead and formed this relationship across those ministries. And from 2018, with His Excellency's vision in establishing an entirely new ministry for climate change and environment as well. Now, this revised manual is a testament to our growth and understanding and all the things that we've been able to learn. You saw from the technical presentation that we didn't just have experts sit in the room and develop this. It's actually been ongoing for about 1.5 years, 2 years from the start, from the moment that we decided that we wanted to update this. And it's been something that has incorporated international best practice. It has gone as far as the rural communities and it's in stakeholder meetings. And it's not just people who are sitting in this room. This collaborative effort, including people in the policy making, research, traditional leaders, academia, really is at the heart and core of why this is one of the best documents that we have seen. Now, as you know, I was talking to the Minister of Environment and he was saying that before he signed it, he had to read every word of the document. Now, I'll tell you that that's also true for me. And I remember when it came to my office for the signature, I had to ensure that I knew what was in there as well. And I want to speak about a couple lessons. The first one is the President's Big Five. Now, this is not happening out of the ordinary, the reason why we're here. Within the President's Big Five, one of the pillars is on public sector reform. Public sector reform is embedded in my office. One of the things that I focused on is the one government approach. And one government means we can collaborate and coordinate across multiple agencies. That also means performance management, and that means we can hold each other accountable. If you look through this document, there are metrics in here for everybody, including myself. And I like checking boxes. One of those is having biannual meetings. So we'll have a meeting today to make sure that we can begin to check those boxes. But accountability is really important within the One Government framework. And I'll focus on, again, two things. Two agencies, the National Public Health Agency and the National Disaster Management Agency. These institutions were established by His Excellency. And I think as a country, we are blessed that the President, can establish institutions that have transformed our present, and it will transform our future. Before I expand on that, when we heard from the National Public Health Agency and everybody, within the Big Five, public sector reform is also decentralization. We've seen that the National Secretariat in the Office of the President goes through to technical representatives who are here, goes through at the district level, all the way through to the chiefdom level. Governance is shaped by policies, but policies by themselves do not really have an impact on people's lives unless they are implemented. And the decentralization that we are speaking about is already saving lives, and I'll give two examples. The last meeting by the Interministerial was in 2020. We will correct that because it's a commitment that we have said we will do through this revised governance structure. But it was during COVID, and it was for COVID response. Now, I remember very well that because of One Government, there were several conversations between the Ministry of Health, then I was at the Ministry of Basic Education, within information, within agriculture, within transport, for how we respond and open schools. There were other countries whose schools were closed for 2 years. I remember that in Sierra Leone, we were attacked for opening schools 5 months after COVID closed, everywhere. And still they can't kill people there, or they send people there in that school, with people there they can't die, we don't know what they do. But the reason why we opened schools then, after extensive conversations in cabinet, was because it was informed and shaped by the One Health approach. I remember conversations in health, and with the people who are there in the response, then Prof was, all of them were involved then. I remember conversations about having the hand wash machines. I remember conversations about masks. I remember conversations about information and the materials we put in schools. I remember that we had testing routines for schools and teachers, and obviously this was built on it was state-of-the-art surveillance approach. It was so state-of-the-art that the people in Boston, my friend, the late Paul Farmer, came to Sierra Leone or used models for Sierra Leone to implement surveillance response in Boston. So the tools that we developed in Sierra Leone were not just best in Sierra Leone, they were best in the world. And that's an example. That's an example of NDMA was established 2 years ago, 3 years ago, really. It has been an NPHA. You know, growing up and over the last couple of years, every rainy season, not just do we hear about lots of flooding, we can't prevent flooding. We can't prevent natural disasters. The environment is where the environment is. Widespread cholera outbreaks in Sierra Leone. This year, no. We tell God thank you, but we also want to tell thank you to the National Public Health. We did it, nobody prays for a disaster. We just saw what happened in the building collapse in Calbatown recently. And in those periods, it was a test and a reflection of what good institution is. We heard that there is a commitment that within 48 hours, that an entire institution, a response mechanism can be up. When the Calvert incident happened, they were there within hours, not 48 hours. We have seen that across this country, back to the element of decentralization, everybody was talking about the smallpox, major outbreak everywhere. And in social media, by the time, by the way, you saw that social media photo of a man with smallpox-like symptoms, there were already response mechanisms by the government. So by the time it went viral, and everybody was afraid that we are going to have smallpox, our system, because of its decentralization, through the district health medical team, had already reached the Ministry of Health, reached the ministry, the Public Health Agency. They sent a team, and within that 24-hour period, had a surveillance system that was already in place. That is what decentralization and One Health does. When the incident happened in Guinea, our team was there within a couple of days. When the incident happened in Liberia, our team was there within a couple of days. We were able to put a team together and dispatch that to Rwanda. So the excellence that has been established by His Excellency through this policy, that you can see that talk and do, but not enough past talk and do, past will and test you. Leadership and all of these policies is really we see the impact and the value when we're tested. We don't want to be tested, but when we're tested, we show up and we are ready and capable to deliver. And across the board, I really want to use this opportunity on behalf of His Excellency, on behalf of the entire government, to really ask all of us to applaud for the One Health entities, the NDME and the NPHA, for the ongoing transformation that is happening. And these have an impact on the country. It's not a singular day that these transformations take effect, but we have seen that year on year, year in, year out, the life expectancy is improving for our people. Year in, year out, maternal mortality numbers are improving. Year in, year out, health outcomes that we are supervising and monitoring are improving. So we really are grateful for the great work that the Ministry of Health, Ministry of Environment and Climate Change, Ministry of Agriculture and Food Security, and the Ministry of Water Resources and Sanitation are doing at the ministerial level, but all of the other agencies who are involved, it is important that we recognize and appreciate their work. And I want to use this moment to really highlight the Ministry of Information and Civic Education for a couple of reasons. A lot of the things that have happened, and they work very closely with NPHA in response to the conversations that we've seen. In the smallpox incidents, the symptom, the misinformation, in the disaster in Calvert, and in many of the engagements that we've seen as a country, when we have close collaboration with the Ministry of Information and Civic Education, because health is about our behavior and what we do as well, and our civic responsibility. When we have close collaboration, we can see that the entire community wins. And so I would like to invite the Ministry of Information to join the interministerial. And I think this is an invite for you, but also when we go to the interministerial meeting, we can officially make that one of our action points. We let folk, and it's how we do it. I really now want to speak to our partners. And USAID, FAO, WHO, CDC, US and Africa, GIZ, Breakthrough Action, ICAP, CARE Sierra Leone, Red Cross, JAPIGO, HIDA, Stop Spillover, Global Fund, World Bank, everybody. Wow. Did I miss a name? I said everybody, yeah. If I missed your name, I mean everybody. Everybody. We really want to recognize and note the impact that you're doing. But also as government is collaborating and coordinating through these governance structures, we want you to also support us in a way that responds to our needs. Yes, we have annual work plans. Yes, we have programs, but nobody planned for Calbat Town to happen. And when Calbat Town happens, in conversations we're doing now with the World Bank, we hope that you can be flexible and willing enough to support the Public Health Agency, disaster management, and the ministries as well. The Ministry of Information always says they don't have money. It's true, they don't have money. But if we don't communicate and support them and account for them in those processes, then our work is difficult. So for everybody else, when you reassign money, plan to give money to the Ministry of Information, because it takes money to help all of us respond. I want to speak to really that the collaboration we've seen in this One Health, One Government approach is an example that we should all be proud of, and one that we hope that other sectors can also learn from. It has been a truly participatory and inclusive review process, and we can see that from the people who spoke here today and what they said, and we can also see that in the implementation. The Office of the Vice President has been central in coordinating several of the health efforts, the HCD team, and we have members here from the Office of the Chief Minister as well, who have been collaborating closely with everybody. NDMA, we can't say your name enough, and it's important that these two institutions, NDMA and NPHA, whenever we think about what establishing good governance looks like, and you don't have to be 50 years as an organization for us to evaluate what you can do. These are 2-year-old organizations, and these organizations we should really look to and learn from. Now, I know one of our partners asked us that we should meet more in the interministerial. That was part of why we needed this governance manual updated anyway, that we can centralize and have dedicated people who are leading on those interministerial. We will commit as a government to meet all of those targets for meetings that are there, because the meetings are important for making decisions. And I call on everybody who's involved, all the ministers who are here, all the technical representatives who are here. You're not just going there to sign your name and leave. Because when you do, we all suffer. When Ebola came, when COVID was there, everybody suffered. The point about One Health and these meetings are not to check boxes and sign your names. They're there for us to plan and prevent, to detect and respond, and we must understand that it is each and every one of our responsibilities, and it must be our priority. It is my priority, it is the priority of government, it is the priority of His Excellency, and this is why I am absolutely honored today on behalf of His Excellency to launch the National One Health Platform Revised Governance.